in relation to children. Is that correct?
I thought there could be an earlier emphasis on wearing masks in the adult population, absolutely, and I think that's one of the things. If we were to rerun the scientific advice, we'd have got to that place at a much earlier stage. For children, I think it's a more balanced question. For the youngest children, I think everybody agrees that they're inappropriate and potentially harmful, just at a physical level, and almost certainly interfere with their development. But I think that there was quite a lot of evidence alongside the benefits to masks from a transmission point of view, that they also interfere with the, particularly the teaching process and the learning process, both of younger children and of older children. And it was for that reason that we didn't have masks in the classroom, except at the absolute peaks of some of the areas where the choices between having a mask in the classroom and probably not having the school open at all. So I don't think any of us really looked back and wished we'd pushed mask wearing more in children and specifically in educational settings, and I think we need to be a bit more differentiated. This is going back to the previous point, differentiated between the adult advice, where I think the advice was pretty clear-cut, albeit not as strong as sometimes implied, and the children's advice, which is quite a bit more of a balance of two risks.
And Professor Whitty, finally, you've set out some of your reflections in your witness statement. May I just ask on behalf of the inquiry whether there is anything further that you would add to those observations, specifically in relation to children, or if it's all set out in your statement?
It is set out probably in my statement, but if I could just highlight one really obvious one, and one slightly less obvious to most people, although you've read my statement. The obvious one is, I think, planning for children and specifically for education should be part of any pandemic, and the hope is you'll never need to use it. But I think not to plan for it is not a good idea, given the extraordinary importance that education has for children. So I think, in a sense, I think everybody who's a witness here would agree with that. But I'm adding my weight to that position. The wider one, I think, is we need to be a bit careful. As I've read some strong but well argued, there are also strong and less well argued things saying we should never ever close schools again. I think that we should be very careful of those kind of statements. Every pandemic is different. Had this been a pandemic like influenza, particularly the influenza pandemic of 1918-19, where a very large portion of the deaths and serious illness were in children, higher than most adults, I think we would very clearly be reaching for schools not only to reduce the overall transmission, but also to protect the individual children. So, and at the other side, the last very serious pandemic, we had the HIV pandemic, school closure would have had absolutely no effect at all. It was a disease of young adults transmitted sexually. So I'm just saying we need to be a bit careful that we don't extrapolate from one pandemic to very different ones, and the routes of transmission also have an implication for that. But I've laid that out in a rather more formal way in the statement.
You have. My lady, those are all of my questions. I think there are some core participant ones. I think some I have asked, but I think there are some residual ones.
I think so, and I think that very helpfully that they've been abandoned, given you have covered them. Miss Hannett, who's just there.
Thank you, my lady. Professor Whitty, I appear on behalf of Long COVID Kids and Long COVID Kids Scotland. On the 31st of May 2021, you advised the Prime Minister, Boris Johnson, that long COVID is clearly a large enough problem to be concerned about in what was entitled a short note on long COVID. You gave evidence this morning that you well understood long COVID in children 9 months after the consensus statement of August 2020 and would have provided information on long COVID to parents had you known about it in August 2020. Why then, some 9 months later in May 2021, at the same time as you were providing that advice to Mr Johnson, was there not a further public statement issued on the risk of paediatric long COVID, particularly given that it hadn't been identified in August 2020?
Well, let me break that down into two parts. I mean, the first of which is, I think you imply a greater degree of certainty than my note says. In fact, I start off my note saying the reason this is a personal note rather than a sage note is there is no consensus. So this was me giving my view, and I was really explicit about that at several points. This is a personal view. And the reason it was a personal view was that the evidence was weaker and more mixed, but nevertheless, I gave the view that I had at the time. There were very large numbers of things in COVID which, as we went along, we understood better. We didn't just issue statements every time that happened. They got into the public domain in any case. Long COVID in children was discussed in the media, was discussed in other fora. So I didn't think that there was a situation where nobody knew about it and only I knew about it and I needed to tell people. That would be completely incorrect. And also, I was quite cautious about going out with strong statements until we had a consensus, or at least a